Hello, my name is Ron Charkowski, and I'm here to talk about diagnostic overshadowing and give an example that I experienced. Diagnostic overshadowing is when a person's known conditions are considered over other factors, such as trauma, when making an evaluation. I would like to share a personal example of this. My daughter, who is autistic, was starting her fifth grade year, and she was struggling with the transition from her third to her fourth period class. She was moving from English, a class she excels at, to art, which was a challenge for her due to some motor control issues. Both my wife and I, as well as her team lead, all thought this was due to adjusting to the new school year, in addition to moving from her favorite class to one she wasn't a huge fan of. She continued to struggle, though, throughout the first week, which caused us to look deeper and to start asking questions. We discovered that the true cause was that the paraprofessional that supported her during her fourth period had mistreated her at the end of the previous school year. At that point, everything fell into place. Of course, she would struggle transitioning to a class supported by a person who did not respect her needs. Who wouldn't? We immediately requested a paraprofessional change, and as a result, transitions became much smoother. So, how do we avoid overshadowing? As we have seen in numerous NCTSN strategies, ask questions, be curious, and don't assume. Also, does this challenge occur in isolation? That can indicate it was trauma related as opposed to a challenge related to their intellectual or developmental disability. In my example, the transition was only a problem from third to fourth period. Other transitions were much smoother. Finally, don't forget that you know your child best. Other support professionals often spend a small fraction of the time you do with your child. Ask questions and do not hesitate to provide information you feel is relevant to the issue. If you don't feel an evaluation is correct, seek another opinion. To conclude, give yourself grace. It is difficult, even for mental health professionals, to detangle trauma and IDD. Use your knowledge about your child to advocate for thorough evaluations to rule out trauma as an underlying cause of challenging behavior.